Hi guys, my name's Heidi and I'm going to show you how to do a SubQ and IM injection and also show you how to draw up some meds. So first, before you do that, you're going to go into the patient's chart. It's called the MAR, and you are going to see what medications are due. Right now we're going to say it's 9 a.m. and the patient does have a couple of medications that are due. These two medications are the Humulin insulin and the other one is Toradol. The insulin is for blood glucose and it just kind of regulates the blood sugar. The patient has had her glucose tested and it is around 150, so we are going to go ahead and give her the insulin, and it is going to require 7 units. She also has food coming, and so that is good for her. It's safe to give her now that we know the units and she does have food coming. For the Toradol, the patient, this is an NSAID, so we just want to make sure that the patient doesn't have any bleeding risks and that the kidney functions are okay. I have checked her labs and everything looks good. She doesn't have any bleeding risks, and she did indicate just a few minutes ago to the AP that she was in quite a bit of pain, rated it at 7. So we're going to go ahead and give her those meds. So before we get started, I'm going to do some hand hygiene.
Pulling the skin back 1 inch and then injecting at a 90-degree angle, taking it out.
I'm just going to put some gloves on.
There's not a lot of room, so I'm just going to say that. So, take my iron injection.
Alright.
And then I go ahead.
So like I said, the orders are for 7 units based on her glucose level. I am going to take these 2 vials in my supplies, and if these had caps on them, they should have caps. This is for practice sake, but you would take the caps off, and then you would clean the tops
And then I would pull away the skin at that point. Putting in the sharps.
of both of these. You don't want to put any needles into this until it's dry,
If there is bleeding indicated,
in case there's any contaminants on top. Alright, so the first medication I'm going to draw up is going to be our insulin, and we're going to draw up the 7 units. Before you draw up any medications, you're going to want to pull the plunger back to the amount of units that you want to draw up. For the insulin, it's again 7 units, so we're going to pull that back.
top of the thigh here.
And I'm going to take the needle and put it into,
Find the greater trochanter
put that air in there,
with my palm.
and then we're going to draw the amount of medication. Sometimes you'll get bubbles, so you can tap it, and then make sure you have the right amount.
And I'm going to be finding
Alright, so here is our 7 units. Make sure that you do not recap this with your hand. You're going to slide the needle in, and then you're going to
those 2 fingers, the
listen for the little click.
will be
There's
the
the
muscle
click.
that I will
I'm going to go ahead and label this medication.
So then the other side, or the other
You don't
side
want to
that I
label
would
it
inject in,
down further so that you can actually
actually
see
the
where
back
you put the
in the
medication.
thigh would be indicated for anything.
On this label, you're going to want to have your initials, the date, the time, the patient's name, the medication, and the dosage that you're going to be giving the medication. Alright, next we're going to do
Then
the
you would find the
Toradol.
greater trochanter.
And again, you're going to choose the right vial or syringe for this, for the amount. For this, it is a 30 milligram per ml vial, and the order is for 20 milligrams. So we're going to draw up 0.7 mLs for this. You're going to use a blunt needle to draw the medication out. For that other needle, it is attached to the syringe, so you won't be taking that needle off.
With the
So you're
thigh
going to
area,
attach the needle,
we would actually take the
and
hand
then you're going to draw
put it
back
above
your
the knee, finding the
0.7,
knee, and then finding the greater trochanter again.
and
then
you're going
between
to
that
take the top
inject
off
there. Sorry, I got this confused for a minute, but
and inject your air.
we got that figured out.
Draw that back.
So
Again, if you have any bubbles, you can knock the syringe. Might have to hit a little hard sometimes.
30 minutes.
Alright, so this is our 0.7.
I also want to make sure that their pain
As you can see, some of the medication comes out, so you're going to want to set it down so it doesn't squirt all over the place. And again, cap the needle.
I dress their pain.
And hear that click? We're going to throw this straight into the sharps. And then we're going to cap it with the new needle that you're going to put in the patient. You do not want to ever inject the patient with a blunt needle. It is very large and it will hurt them very much. Okay, so now that we have this one done, I'm going to go ahead and label this one. Same information, patient's name, the dose of the medication, the name of the medication, date and time on your initials. And again, make sure you're not covering the amount of medication in here so you see that you have the proper amount in here. Alright, so I'm going to go ahead and remove my gloves, do some hand hygiene, and I am going to show you how to do the injections for these medications. Knock, knock. Hi, Ms. Tract. I'm here to give you your morning meds. Is that okay?
Yes.
Okay, I'm just going to shut the curtain for some privacy here. So I looked up your information, and it shows that you are due for Toradol and also for your insulin. I see that they checked your insulin or your blood glucose, and it's a little high, so we're going to go ahead and give you 7 units today. Before we get started with any medications, just let me have you verify your name and date.
I put it in and I was like,
Irina Track, 10/12/59.
Perfect. Okay, and I see that matches my medication and my MAR. Again, like I said, we are going to give you your insulin today. Your glucose levels were about 150, so we're going to go ahead and give you 7 units. This is just to kind of regulate your blood glucose, make sure it's not going too high. One of the biggest things you want to make sure is the patient is going to be eating within 30 minutes or so of the injection, because it is an intermediate acting insulin, so it'll be about 1 to 2 hours before it starts to kick in. And you want to make sure that you have tested their glucose. And never, never, ever mix insulins up. It can be very dangerous. Alright, and we also have your Toradol in this track, and I was told that your pain is around 7. Is that correct?
Yes.
Okay, so just so you know a little bit about this, this is just for your pain. It's a steroidal anti-inflammatory medication, and so it's going to help with the pain that you're having right now. Again, you're going to want to make sure that their kidney function is okay, looking at their labs and making sure that that they do not have any bleeding risks. Ms. Tract does not, and her labs look pretty good. Alright, so I am going to sanitize my hands. So I saw in your chart, Ms. Tract, that they do your insulin injection in your stomach the last time on your right side. Is it okay if we switch it up and put it on your left?
Yes, that's fine.
Alright, so we'll do that. I'm going to raise the bed a little bit here, okay? Now, there's a few spots you can do SubQ. Most typical spots here, clockwise or counterclockwise on the abdomen, and you're just going to want to alternate spots so that you're not causing a lot of bruising or tenderness. And then also make sure before you give any medications that you are asking the patient if they have any allergies. Let me ask her that now. Ms. Track, do you have any medication allergies?
No.
Okay, great, perfect. All right, so we're going to go ahead and administer your medications. We'll do your insulin first. I'm going to go ahead and put it on your stomach. And like I said, there's a few spots you can do it on the stomach. And then there's a little fatty area back here right above your hip. Or you can do in the back of your arm here. Alright, today we're going to do on her stomach, on her abdomen. You're going to want to clean the patient's abdomen. So we're going to do her abdomen. You're going to want to wait for that to dry. Now with patients, for these medications, the angle is important. You're going to want to make sure that's either 45 to 90 degrees. That would depend on how heavy the patient is. If they are thinner, you will go ahead and use a 45-degree angle. If they are a little heavier, you will go in straight 90 degrees. Once this has dried, you're going to kind of squeeze the patient's stomach just to get that fatty tissue pulled up towards you, okay? So I'm going to go ahead and I'm going to remove my lid.
And then again, I'm going
to take this and kind of like a dart, I'm going to inject the patient, holding their skin, pinching that about 1 inch, and at an angle 45 degrees, you're going to put it in the patient's abdomen, inject, and then you're going to pull it out, activate your safety, and you're going to throw that right there
to the patient's room.
Sharps. All right, we're all done there, Miss Track. Okay, so next we're going to do your Toradol. I saw that they did it over here in your deltoid on a couple days ago, so we'll go ahead and do it on this arm. There's a few places you can do an IM injection. So we're going to do the deltoid. It's going to be just right here at the acromion process, 2 to 3 fingers down, and we're gonna do a Z track today. So once you find that muscle, you're gonna kind of pull the skin just taut, and that's called the Z track. First you'll want to obviously sanitize the patient's arm, and then mark your spot on the patient's arm. So I'm gonna find my spot here, clean this, and you're going to let that dry. The other spots are going to be your vastus lateralis. That is between the knee and your greater trochanter, which is kind of like a hip bone here. And it's somewhere in between here, right in the middle. If you can't find it, you can always have your patient flex their leg and you'll feel the muscle contract when they do that, and then you'll be able to find that spot. Another spot would be on your ventrogluteal. That you would have the patient roll on their side, and I can show you here. You would have the patient roll on their side, and they would bring their knee over on top of their other leg, making sure that they are relaxing this leg. And then you're going to use, with your non-dominant hand, find that greater trochanter, that hip muscle. You're going to put your hand on there, and then you're going to put your middle finger towards the iliac crest, and then your pointer finger, your index finger, towards the umbilicus, which is towards the anterior superior iliac spine. And right here in that spot right here is where you're going to inject that medication into the muscle. Again, you're going to want to have the patient relax, because you don't ever want to put meds in a tense muscle. Okay, so now that her arm is dry, I am going to remove my cap. And we are going to, now that I know where we're putting, I'm going to pull the skin, and I'm going to inject the patient, put in the medication, and this is going to go straight into the sharp skin,
And then I will put this in sharps.
and I'll put a little Band-Aid on there for her.
How are you feeling? Is that okay? The patient is okay. So we're
You
going
feeling okay, Miss Track?
Yes.
Okay, so we're all done with your 9 a.m. medications, okay?
Okay.
Can I get you anything?
wipe it off and put
No, I'm okay.
Okay, and are you comfortable in this position?
Yes, I am.
Okay, do you want any of your past possessions you need to use the restroom?
No, I'm okay.
Okay, great. So I know that it's going to take a little bit of time for that pain to come down, so we'll come back and check on you in a little bit and see how you're doing. Your breakfast is going to come on in here after I leave, and you'll be able to eat your breakfast, okay?
Okay.
All right, I'm going to lower the bed and lock it.
find this spot, I will pull the gown up.
And then I'm going to go ahead and document any assessments I made, anything regarding her pain, the injection sites, and just document all that stuff in her chart, and then that's it.
Triangle and find that spot.